Arthur, and this is part 3 in a series of frequently asked questions on dizziness and balance disorders. Now, in our last video, we discussed how a common cause of dizziness is a malfunction in the impulses between the cerebellum, which is a part of the brain, and the inner ear. Today, or in this segment, I've got a few simple tests that you can do to confirm whether this is actually happening in you. The first one, you want to have an open area where you won't bump into anything. You're going to close your eyes, and then you're going to walk heel to toe. Just like this. Now, while you're walking heel to toe, you want to pay attention to whether you sway or wobble or lean or fall to one side. And if you do, that means you've got a problem. Okay, now on this test, what you're going to do is you're going to bring your right index finger up above your head, just like this. You're going to bend your head backwards to look at your finger, close your eyes, and then you're going to bring the tip of the left to meet the tip of the right. Now what's going to happen is, if there's no problem, you're going to be able to bring your fingers together just fine. If there is a problem, what will happen is as you get up here, you're going to start searching, and then you'll find it, or you'll bring it up and overshoot, or you'll bring it up and miss entirely. So if you're able to bring them together just fine, that's great, no problem. If you do any of those three things where they're searching, overshooting, or missing entirely, you've got a problem. And you want to do that on both sides. So left to meet the right and right to meet the left. And notice which one was more significant or more severe. Okay. On this test, what you're going to do is you're going to need to use a pen for a target. You're going to follow with your eyes. You're going to need a partner who can observe your eye movements. And what you'll do is you're going to put a pen up about 12 to 18 inches in front of your eyes. You're going to focus your eyes on that pen or on the tip of the pen, and you're going to turn your head to the left as far as you can comfortably, or not, just turn your head to the left and then back to the center. And you're going to be keeping your eyes focused on the tip of the pen the entire time. And then you're going to do that a total of 10 times. Okay. Now what you want to have your friend observe is a couple things. First, as you're turning your head, is there ever any little ticks or jumps in your eye movements where your eyes they're basically trying to correct themselves and get back on target? Have your friend observe for that. The other thing you want to have your friend observe for is as you turn your head, do your eyes ever follow your head movement? Or are you unable to keep your eyes on the tip of the pen while you're moving? The thing that you want to observe within yourself is, does this test make you nauseous or dizzy? And so you're going to do it 10 times to each side, and then 10 to the other side, observing for those symptoms. And if you notice those things, you've got a problem. Now, if you had any problems while doing those tests, you know you have a malfunction between your brain and your inner ear that's causing your dizziness and your balance disorders. So, should you be taking medication for your dizziness? We'll cover that in the next video.